Good morning. I want to go ahead and call our Health Subcommittee of Appropriations to order, and we'll begin with our budget presentation. As we do want to make a couple of comments before we start. The House approach to the fiscal year 2021 budget for Medicaid, Peach Care, Public Health, and the healthcare workforce was twofold. First, to restore and maintain the progress we've made over the past several years in committing significant resources to help ensure adequate health care services are available to citizens in all of our 159 counties. Secondly, to strategically commit funds where we believe they can have a significant short-term as well as a long-term impact on the well-being of our children, the elderly, and those in need of health care in this state. And having said that, I'm going to go ahead and begin running through the changes. There are quite a few of them, so I'm going to move quickly. If you will look first on 17.4.3, we're saying no to that cut and restoring this money for the Rural Health Systems Innovation Center. 17.4.4, we're catching the $500,000 that was put in there for the federal FQHC startups last year, and that's tied to 17.4.5, where we're recommending two new startups. One would be a primary care in Wayne County, and one would be a school-based center in Irwin County. And 17.4.6, this eliminates one-time funds for a grant program that was started last year, that those funds have not been spent, so we're able to have a savings there. 4.7, this provides funding for the charity clinics, and 4.8 is increased funding for the rural hospital stabilization grants. Under 17.5.4, this will increase funding to be able to provide 4 surveyor positions. These are the folks who will actually go out on site and do inspections in assisted living homes, personal care homes, and so forth, and we think that will help. 17.7.8, this is an increase to expand the quality initiative programs for nursing homes who do quality care. 17.7.9, this is a 3% increase in Medicaid ventilator reimbursement rates. Under low-income Medicaid, 17.8.1, there's a slight reduction there. This is in the growth funds, just a later number there to true that up. 17.8.9, this is increasing funds to provide for 6 months of postpartum Medicaid coverage for mothers. This would become effective July 1 of 2020. And also tied into that, 17.8.10, this would increase funds to provide lactation care and services in a bill that was passed earlier. 17.8.11, this would provide reimbursement rates to select primary care codes, some 100, over 100 codes for our primary care doctors, and this will help the doctors as well as the hospitals. 17.8.12, this is to provide funds reimbursement for silver diamine fluoride. This is for the children to help reduce the decay in cavities. Under Peach Care, 17.9.3, this is just saying to use the funds that we provided in 17.8.12 for that service for the children. 17.10.1 is a reduction in existing technology contracts, statewide programs to state health benefit plans. This is language only. 17.12.1, this is a truing up of the increased funds for the 133 residency slots. Actually, that number is 185, so we're truing that up to take care of that. 17.12.2, a slight adjustment there in a true up of the FMAP number. 17.12.3, this is to, we're saying no to those cuts for the accelerated track program at Memorial in Savannah. 17.12.7, reduced funds to fellowships at Augusta University. We're saying no to those. 17, 12.9, 12.10, 12.11. We're also saying no to those cuts in the fellowship programs there in Augusta. 17.12.12, this is to provide funds to match federal fund startup for a rural psychiatric residency program at Colquitt Regional Medical Center, and we're in partnerships with the locals down there to start up that residency program. 17.13.2, this we're saying no to the reduction in the funds of the Mercer School of Medicine operating grant. Same thing with 17.14.1 at Morehouse, saying no to those cuts there. The 17.15.1, we're saying no to the reduction in the loan repayment program for rural advanced practice nurses, dentist assistants, and physician programs on their loan repayment. Under 17.16.2, reduce funds for student capitation payments to our medical schools, Emory, Mercer, Morehouse, and PCOM. We're saying no in that. That would have been a 7% cut to that program. Georgia Medical Composite Board, 17.17.3. We're adding funds to for one medical director. This money was put into the budget last year, but was disregarded by the governor's language in that. We think that's important to help them. Same thing under 17.18.5. This is to put the money back in for a data management system for Georgia Drugs and Narcotics, help them be more efficient in their business. Under public health, 38.1.6, we have reduced the cut to the Sickle Cell Foundation by $150,000. We were able to restore part of that. 38.1.7, this deals with CORE, the Georgia Center for Oncology Research. We have reduced the recommended cut by 1/2 in that number. $38.3.7, this would be a slight adjustment there in that reduction of funds for 14 vacant positions, and we enumerate those positions there and true up that number. 38.3.9, this is really a budget bookkeeping area adjustment, and you'll see this, it ties to 38.12.3 relating to the Fulton County Board of Health. 38.4.5, this is under emergent preparedness. We're saying no to that cut because we feel like that we don't need to reduce any of the funds to the emergency preparedness right now with the coronavirus that we have in this country. 38.5.4, we're saying no to the reduction in the hepatitis C testing kits. 38.5.5, we're saying no to the reduced funds for the Georgia Poison Center. And then 38.8.6, this is a small add that relates to a recommendation from the Georgia Newborn Screening Advisory Committee where they would test newborns for one more newborn disease. 38.9.7, this is the increased funding for the first year of a 3-year pilot program that deals with individuals with high risk of HIV. 38.10.3, we're saying no to the reduction for these 3 vacant positions because these positions are filled. And we feel like they ought to be funded. 38.12.3, this was a 7% recommended reduction to the county boards of health across the state. We are saying no to that and reduce that cut from 7% to 3%. And then 38.12.4, this deals with Fulton County that I mentioned to you, ties back to 38.3.8, which is just really a budgetary bookkeeping entry. under the Georgia Trauma Commission, 38.15.12. We're saying, it says reduce funds to contractual services. We're saying no, use the $1.6 million in existing funds to support Grady Memorial's hospital efforts to do the continued program of coordinating the emergency room entrance for the 13-county metro Atlanta area. And that's the cuts on the tracking sheets. And just want to say that, you know, we've made a number of changes to the governor's recommendation in this budget. Many changes have been to restore cuts to programs the House and the Senate have worked hard over the past several years to build up, with a goal of that all Georgians have access to quality health care. Access to make sure that not only their families thrive, but their communities thrive as well. We've also added a few items to help address critical needs such as maternal mortality, assistance to our rural hospitals, supporting our medical education programs, to adding more critically needed doctors to our communities. We look forward to working with the Senate and the governor to pass a budget that promotes access to quality and affordable health care for all of our citizens. We have the budget. Any questions from the committee? Could we have a motion? Have a motion to pass and a second. Any discussion? If not, all those in favor say aye. Any opposed? Then it passes unanimously. Thank you very much.